The Best Docs Network helps you find some of the best doctors utilizing the latest procedures and practices in healthcare. Actual patients and the doctors themselves walk you through their stories that together help you make the best decision in your search for the right doctor. On today's episode, oral surgeon Dr. Paul Metz improves his patient's life with dental implants. Facial plastic surgeon Dr. Yadro Ducic discusses his philosophy on practicing medicine. ENT Dr. C.T. Wynn talks about a procedure called balloon sinuplasty. And doctors from Forest Park Medical Center utilizing the latest in technology and techniques.
Originally, I was having a lot.
That you breathe in. So it becomes enlarged and inflamed when it is irritated by either allergies, infection, or pollution in the air. Considering her busy schedule, we decide upon a two-pronged approach treatment. Balloon sinuplasty in office to treat her sinus issue, and inferior turbinate reduction to relieve her nasal obstruction.
I don't really have any more sinus issues. I haven't had a sinus infection since the surgery, and it's been a few months now.
The advantage of balloon sinuplasty is that it can be done in office. There is no general anesthesia. The cost is less than doing it in the hospital, and the recovery time is really quick. There's really no downtime. The patient can go back to their daily activities quickly.
It's actually kind of funny. There's a lot of things that I didn't realize were issues until after the surgery. I know one time I was sitting in my bathroom and I was sitting there and there was a candle about 2 feet away from me, and I actually could smell it. And that was something that I have never done before, and it kind of just hit me. I was like, I can actually smell the candle.
Did you know that establishing a bedtime ritual helps your body know when it is time to sleep? You can establish a bedtime ritual by doing the same things, such as brushing your teeth, reading a book, or listening to soothing music every night an hour or two before bedtime to relax your mind.
I was afraid because I knew I couldn't walk anymore. And I knew I had to have something done. My right leg, I just was unable to use anymore. I had arthritis all through my back, so my sciatic nerve was hitting on my spine, hitting on my disc, and then hitting on these joints. And that was what was causing the severe pain and the nerve damage that was going down my leg.
Donna presented to me with a history of chronic progressive back pain, as well as pain radiating into her lower extremity, consistent with pinched nerve or sciatica.
When I saw Dr. Bannister, as he talked, I could feel the stress just coming out of my body. I got here and he was kind. He took extra measures to make sure there was nothing else needed.
So the surgery for her is actually called lumbar decompression and fusion. And that's where the starting point of the surgery, we remove this so-called lamina, basically the back of the bony canal, so that her spinal sac is freed. We free up her exiting nerves, and then we actually put some screws into the bone above and the bone below. Then we actually proceed with the fusion.
I was walking when I left and I felt great, and it was just amazing to be able to walk without pain again.
Donna is doing well. Lumbar fusion to me is a big undertaking. I reserve lumbar fusion for those who have true slippage of their vertebral body, one on the other. I do not perform a lot of lumbar fusion for back pain. I'm very careful.
Thanks to Dr. Bannister, I'm walking, I'm without pain in my hips, am now able to drive. I spent months in the house not being able to and had to depend on someone else. And now then I feel freed.
To learn more about Forest Park Medical Center and their doctors, go to bestdocsnetwork.com.
Hi, I'm Jim Knox, and a lot of people have asked me, hey, what do you do away from the ballpark? Well, I am co-founder of a company called Identity Media Services. Our Emmy Award-winning production team can brand your company with videos, commercials, radio, and television, and our digital performance program specializes in lead generation, websites, and reputation management. So if your business needs a lift, give me a call, because as you know, it is tough to stay on top. Whew, that's gotta hurt.
I didn't feel good about myself, and I never wanted to go anywhere. Now my world has opened up. I occasionally go out with my girlfriends, and we have a great time together.
I was getting older and didn't really care about my weight, but my doctor said I needed to do something immediately. Now I'm spending time with my grandchildren, and every moment seems special.
My one reason was to live life again.
My one reason was to simply live.
So what's your one reason?
Barker Bariatric Center. Log on or call today for your consultation.
Find your doctor on bestdocsnetwork.com.
What is advanced lipid testing? Most of my patients say, well, I had my cholesterol checked with my doctor. I say, well, advanced lipid testing is different. It evaluates different parts of the cholesterol, different areas that we can effectively make change. So it's important to do an advanced lipid analysis. There are multiple companies who provide that service, but ask your doctor to look at your lipids in a more advanced way, because there are things on the lipid analysis that can tell us if you have early diabetes, insulin resistance, if you have a high tendency towards clotting, if you're genetically prone towards having a heart attack or not. These are important questions that you need to know. When we're sitting out there in the communities and we have physicians that may or may not know about these things, I think it's important that there are informational shows like this out there that can teach you, the public, to check on your own health. So ask your doctor for advanced lipid therapy. It's an amazing way to take hold of your own health.
So before I met Dr. Duchik, I just felt like my skin was dull and spotty and splotchy, and was constantly trying to search for makeups that would make a difference transitioning into my 50s.
Skincare is obviously very, very important. The skin is what everybody sees. They don't see the underlying bone. If we do somebody's rhinoplasty, they're not looking at their cartilages, they're not looking at their jaws, their cheekbones, their eye sockets. They see the skin. That's the first thing that you see. So ideally, you want the skin to look as good as possible.
Typically, Dr. Duchik does like me to see patients before they have surgery. He'll do a consultation and he'll send me in the room and say, please talk to them about skincare. Let's get their skin looking good first, and then we'll, discuss surgery.
I always feel at home with Jennifer. She is a very well-versed in skincare, and she pays attention to my age, and we stay really focused on what it is that I'm trying to accomplish.
Well, the whole point of doing cosmetic surgery on somebody is to make them look better and feel better about the way they look, and more comfortable in their own skin, so to speak. And so one of the first things we always try to do is tune up the skin, make the skin look as good as possible, because then people oftentimes are so happy with their skin that they don't feel like they need to sometimes even do surgery.
As you get older, your body you lose the collagen in your skin. Collagen's kind of like the springs in a mattress. You start to lose volume and you'll start to notice fine lines and wrinkles. By stimulating the collagen, your skin will become firmer and the wrinkles will start to dissipate. There's several different things that we offer that help stimulate collagen, one of them being the Dermapen. It creates micro injuries to the skin, and when the skin starts to heal, it starts to rebuild collagen, which is pretty amazing.
And the goal is not to do surgery, the goal is just to make somebody look better.
I no longer have to search for makeups that cover up. I just feel younger than I thought I was going to feel in my 50s, and just feel brighter, and that my skin finally is at a place where it's glowing.
Ken has a question for Dr. Lindsay Arvizo. Why do I frequently lose my voice?
People can lose their voice frequently for many reasons. It can be from an actual lesion on the vocal cord, or a traumatic injury to the vocal cord, or they're just using their voice incorrectly. If anyone has had vocal issues or hoarseness for more than 2 weeks, they should be evaluated by an ENT physician and have their vocal cords evaluated.
Ask our doctors on bestdocsnetwork.com.
My teeth needed to all be extracted. They were crumbling, they were breaking, I couldn't chew my food.
He's a professional, an accountant, and he's certainly concerned about finances and how to structure his budget. And he was a guy that his lower teeth were worse off than the uppers. And so that was an area that he decided to focus on.
I guess this started in 2009, and this really happened in two settings. So that in 2009, we did the lower, and in 2011, we did the upper. The bottom is all done, and I'm in the midst of having the prosthesis on the top done.
And also with David, his concern regarding his budget, we were able to do this without grafting. Previously, in the upper jaw, because of the maxillary sinuses, we would have to graft those areas. In majority of cases that we were placing a full jaw worth of implants. But with the advent of cone beam CT, we're able to look at individuals from a three-dimensional standpoint radiographically ahead of time so as to know where the bone is, so that we can position implants within that bone and avoid the need for sinus grafting, and then subsequently lower his overall costs significantly, as well as increase the predictability.
No longer do I have to make sure that everything is in place where it's supposed to be in place. I have a new chance at a brand new set of teeth, and they don't hurt.
It's satisfying to see him come back smiling, see him walking down the hallway, standing upright with their chin up, smiling, and being much more confident. So from a psychological standpoint, outside of the health benefits that you see, the mental health benefits are significant.
I'm a CPA. I meet with clients and high net worth clients. Appearance is important to me. It's certainly not of the utmost importance, but it's important to me. And I don't want to be embarrassed by a crumbling smile line. It's a wonderful, wonderful solution.
Coming up on the second half of today's show, learn more about the Texas Heart Institute and their doctors with interventional cardiologist Dr. Annie Varghese. Plastic surgeon Dr. David Altamira gives his patient the looks she's always wanted. Family medicine doctor Richard Honecker addresses common health concerns in our Medical Minute. Bariatric surgeon Dr. Scott Stowers with My Bariatric Solutions helps his patient lose weight. As well as more doctors from Forest Park Medical Center utilizing the latest in technology and techniques.
I've experienced in my past excessive weight gain. I would diet, lose, gain, lose. I was embarrassed. I was ashamed. I didn't feel good, and the more I gained, the less I felt confidence. I had made the choice that I needed to really make the decision to change my life, to get my health back on track.
Charlotte had a lap band procedure, which is one of the most common procedures that we do. She's been very successful for her. She lost her predicted weight that she wanted to, and the several different medications she took, she doesn't take anymore.
I decided to have the bariatric lap band at My Bariatric Solutions. I have a lot more energy. I strive to do things that I wouldn't have before, experience some exciting things on some of my travels.
A band is put in laparoscopically through small incisions in the skin. We put the band around the top of the stomach, and it's a balloon, essentially. It has a port that goes up under the skin, and we can put salt water in there and tighten the band up. That keeps the food in the top of the stomach and makes people feel not hungry with a small amount of food. It works like a long-term diet, only you feel full with small amounts of food. The most important part of a band patient doing well is frequent follow-ups and getting their band adjusted, especially early on. First 6 months, we will normally do about 5 adjustments until they learn how to use the band. After that, maybe one every 6 months, and then later on, maybe once a year.
My experiences with Dr. Stowers and his staff is so easy. I arrive, I'm seen in a timely manner, in a professional manner, and people are so friendly and they treat me as a family. Each time is very special, and I look forward to seeing the doctor. He's very friendly, very cordial, and very professional all at the same time.
Request an appointment on bestdocsnetwork.com.
Another reason to stay hydrated throughout the day is because your brain is composed of 75% water. Your brain will also begin shrinking 0.25% in mass each year after the age of 30.
How do you know the difference between having a bad cold and having allergies? It's important to know because sometimes that depends on whether you go to the doctor or not, or whether you stay home or not from work or school. Well, a bad cold is caused by a virus. So you generally have fever, you generally feel bad, you feel achy. The reason you feel achy is the viruses live in the tiny capillaries in your muscles. So in those capillaries, they swell up because the virus is there, and then you hurt. Also, you generally get chills and have generally been exposed to someone who's had similar symptoms. Allergies, you generally tend to sneeze, you don't have achiness, you don't have fever, you don't have chills, you may have itchy eyes and runny nose. Also, when you have a bad cold, your mucus, the stuff that comes out of your nose or your lungs, might be discolored, thick, yellow-green, whereas it's going to be thin, clear, and watery when you have allergies. Now, there's different ways to treat these things, especially if there's a bacteria involved. You might need antibiotics. So basically, just remember, it's fever, chills, and just feeling horrible all over. That usually means a bad cold with a virus or a bacteria, and you need to see your doctor. Otherwise, it's probably just allergies. Just get some stuff over the counter.
I had kind of a bump up here on the bridge, and the end kind of hung down a little bit. It was a little bit big. And I think a couple times in my life, guys had made comments like, oh, our kids would have really big noses.
Well, Holly came in with just the thought that had bothered her for a long time, that her nose just didn't match her face. She's an otherwise very attractive young lady, but she'd always had just a large nose that was out of proportion to the rest of her face.
I mean, overall, Dr. Altamira made the experience so easy and simple, and I think out of all the doctors that I spoke with, he was the one who made me the most at ease with the process, and he said, you know, you can always do more, but let's do something modest for now, and it's just overall really comfortable.
First, we talked to the patient at length. We asked them what they like about their nose and then what they don't like about their nose. There are certain things that, you know, we can change and certain things we don't want to change if they're happy with that. We'll take several photographs from different angles, and then we can project them on the computer screen for the patient, and we can actually morph the images to show the patient what they can possibly look like. And that way we can make sure we're on the same page as far as what the patient wants to look like and what can actually be accomplished in surgery, so that they do have realistic expectations We can kind of give them a good idea of what they'll actually will look like after the surgery.
The recovery time was really quick. Dr. Altamira had explained that it would hurt for a little bit. He even gave me painkillers, but I think I took 2 of them. It wasn't as painful nearly as I thought it would be. And I think I had some soreness if I would touch it for maybe a month after, but overall it didn't hurt.
Rhinoplasty is basically changing the shape of the nose. It can be done for a variety of reasons. Usually, a lot of times, just the patient has always felt their nose was too big for their face. They were never happy with their appearance. And so it's basically a great operation that can be used to reshape the person's nose to match their face better.
It was so exciting taking that Band-Aid off for the first time. Like, when you look at yourself in the mirror, you always notice an imperfection that maybe you don't like. And for the first time I looked and thought, oh, my nose is adorable.
Tamra has a question for Dr. Cody Myhills. Why is it important to know my family medical history?
It's very important for a patient to be aware of their family medical history, primarily for preventative care. There are many disorders from heart disease to certain types of cancer that do carry genetic predisposition. So it's important that you have as much information as possible, primarily for your first degree relatives, meaning your parents or your siblings. Those are the ones that have the most impact and that are the most beneficial for your primary care doctor to know about. However, more information is always better. So the more you know about your grandparents and your uncles or aunts, if there's any type of cancer in the family, heart disease, stroke, type 2 diabetes, we really need to know that so that we can take the best care of you and know which conditions that we really need to pay attention for screening purposes.
Ask our doctors on bestdocsnetwork.com.
Did you know eating oysters can keep your immune system strong? A 3-ounce serving has 1/4 of your daily iron intake, plus twice the zinc that you need in a day.
I had a lot of pain in my neck and my lower back, and I was referred to Dr. Lewis by one of my other doctors as a pain management doctor. He thought that Dr. Lewis would be able to help me with either injections or pills or something like that and not go the surgery route.
When Phil first came to see us, he was experiencing back pain, which was made worse with standing, walking, lying flat, twisting, which is typical of somebody who has some pain in the facet joints. He also came to us with an MRI that demonstrated some facet changes as well. A facet is a true joint in your back, just like your knee or your elbow. You have those joints all the way up and down your spine at each level, and they're like the gears of the spine. That's what allows the spine to move the way it does. It has a capsule and a nerve supply to it, and when that gets enlarged or irritated, it causes pain.
In actuality, I'm in pain every day. It's just a matter of how bad it is, and Dr. Lewis has been able to help with bringing that down to a manageable level through his procedures. Dr. Lewis performed a rhizotomy on my cervical and my neck, and he's also performed a rhizotomy on my lower back, and it has relieved the pain in both places.
On Philip, we performed a facet rhizotomy. So what we can do with the rhizotomy is we can come back and make a lesion of the nerve that supplies the joint, which destroys that nerve for a significant period of time, usually 6 months or more, before it grows back. Phil's doing very well. Phil's not 100% pain-free, but he has much better mobility, range of motion, and he's able to participate in a lot of activities that he wasn't able to before.
Before the rhizotomy, couldn't really do hardly anything, couldn't work out. It was hard to get out of bed. Pain basically drove my life, is what it did. It was in control. And after the rhizotomy, I could take control back over my life to a certain extent because the pain has been cut. So then I can do things that I want to do rather than the pain controlling and telling me what it wants me to do or can't do.
To learn more about Forest Park Medical Center and their doctors, go to bestdocsnetwork.com.
A recent study in the Journal of Periodontology shows that 2 ounces of yogurt a day may protect you from gum disease. The typical container of yogurt holds 6 ounces, and the good bacteria in yogurt helps fight germs in your mouth.
Find your doctor on bestdocsnetwork.com.
Welcome. Today we have with us Dr. James Willerson, who's the President and Medical Director of the Texas Heart Institute. Dr. Willerson, we're so thankful that you're with us today. Welcome to our program.
Thank you.
We know that you've had a long history here in Texas with regard to the advancement of cardiovascular services. Would you tell us a little bit about the Texas Heart Institute?
The Texas Heart Institute was founded in 1962 by Dr. Denton Cooley as a research and education entity. And I think he dreamed that it would train many doctors who wanted to be heart doctors, cardiologists, surgeons, electrophysiologists, pathologists, so on, but that it would also do research, which would be important in preventing cardiovascular disease and making it easier for people to tolerate it when they already had it. And that's the way it's worked out over the last 50 plus years. It's ranked number 6th in the United States. It's been ranked in the top 10 for each of the last 22 years consecutively. There is no other heart center in Texas for which that same thing has been true. And we have educated thousands of doctors in all areas of cardiovascular disease.
I know that your great passion is teaching, and I've been able to sit at your feet and actually learn from the master, and I just thank you for that.
Thank you.
In front of the world, you are an amazing teacher.
Thank you.
And I know that you have taught many, probably thousands of students in internal medicine as well as cardiology. We want to thank you for that, and what would you tell the world about those who have that love for cardiovascular medicine and to study medicine? What would you tell those students?
Well, it is a passion, but it's based on the reflection that heart and vascular disease are the #1 killers of men, women, and children, not only in the United States, but in the world. Cancer's a distant second. For instance, as a woman, you're more likely to die of heart and vascular disease than you are of all cancers combined. And as a woman, you're 5 times more likely to die of a heart attack than you are of breast cancer. And as a man, 1 out of 2.5 men worldwide will have some form of heart and vascular disease during their lives. A person dies in the United States every 26 seconds, 24/7, of heart and vascular disease.
So we want to let students know around the world to continue reaching for their passion of saving lives. And we thank you for being a leader in that, Dr. Willerson.
Thank you very much. You're very kind.
You are a tremendous person. I just thank you from the bottom of my heart.
Thank you.
Watch more videos on bestdocsnetwork.com. Didn't find the doctor you're looking for on today's episode? Head to our website, bestdocsnetwork.com. There you can search our video library by topic, specialty, and doctor. The Best Docs Network, helping you find the right doctor and bringing medical education to you.